My name is Dr. Tobias Chapman, and I'm a radiation oncologist at the Inova Schar Cancer Institute. While I have experience in the treatment of all different types of cancer, I do have a specific clinical and research interest in the treatment of gastrointestinal cancers, head and neck cancers, and prostate cancer. When I meet patients in consultation, they are often a little confused about what role a radiation oncologist plays in their care, or indeed what we even do. I usually begin the consultation by explaining to them the concept of how radiation is one of the three main pillars of cancer care: radiation, surgery, and chemotherapy or systemic agents. I think one of the real strengths of the Inova Schar Cancer Institute is the various different radiation modalities or platforms that we have to treat our patients. Every case is unique, and when we have different radiation treatment machines available, it's really helpful for us as radiation oncologists to be able to choose the correct tool for the correct job for our patients. One of the things that I'm most excited about is our proton radiotherapy treatment facility. Proton radiation is a different type of radiation from the more traditional X-ray radiation that you may have heard about. This is actually a particle beam. Very high energy particles are accelerated by a special machine, and as they enter the patient, they begin to slow down, and at some point within the patient, they will actually stop and deliver all of their energy or radiation dose at that point inside of the patient. What this allows us to do is, using the energy of the beam, we can shoot the beam at the patient and tailor the depth at which it stops inside of you such that no radiation will pass beyond that point. My favorite thing about my job is actually the time that I get to spend with patients. It's honestly the most rewarding part of what I do. I do very much enjoy the technical aspects of radiation delivery and understanding sort of how we fit in the overall treatment plan of a patient. But there's nothing quite like spending time with patients and getting to learn things about them. In the first consultation, I always spend some time at the beginning just asking the patient questions about themselves, their priorities, their beliefs, their thoughts about their disease. One of the most critical questions I've found is actually asking the patient right at the beginning, what do you understand about your disease? The other thing that I really love is that once we have treated patients, we get to see them for a long period of time after. We follow them. We obviously are involved in their cancer surveillance, but also monitoring for the late potential effects of radiation therapy. And so we really develop strong relationships with our patients and sort of get to see them do well and recover. And that's really what I find most rewarding about my job. My name is Tobias Chapman. If you find yourself in need of a radiation oncologist during your cancer journey, I'd be privileged to be involved in your care.